Hi, Priyanka. I
How
hope
are
everybody's
you?
good. I'm having a good day. Everybody, I hope, is having a good day. I just wanted to welcome everybody to the Resident and Family Support Council. We have this meeting every other week. And the purpose of this meeting is to empower people with information so that we can feel like we're getting our needs met better in regards to long-term care. So today we actually are going to be talking um, we want to hear from all of you. It's been a struggle, I know, for people in the past in regards to visitation, and we should start seeing things opening up. Last time, Jessica Belsley, who is the ombudsman specialist who works with us at the state ombudsman's office, she provided us information on what the federal government had come out with some recent guidance. And with that, we just in the last couple of days, as of last Friday, we got Illinois' response to that guidance. So that helps us a little bit more understand what we should be seeing in regards to visitation in long-term care. So today we do have, I believe we're going to have some people from IDPH also help join us to help answer the questions. I don't see if they've joined us just as of yet, but I'm keeping my eye open for that. We're going to start with Jessica's going to kind of refresh us on what we talked about last time in regards to the changes that have occurred federally. And then also she's added in some of the information in what it looks like now for Illinois specifically. And then we're going to open up those mics so people can feel free if they want to either put it in the chat, or if they want to go ahead and unmute yourself, you will have the ability to do that as well. Because we understand that sometimes those questions can get a little complicated when you're trying to ask them, and to type it can be a little difficult. So this is your meeting, and we want to make sure that everyone gets their needs met through the course of this meeting. So Jessica, I'll go ahead and I'll turn it over to you right now. And you could help share with us what's going on here with visitation and long-term care.
All right, thanks, Lee. As we were planning this meeting, we decided to do a little bit of a refresher and cover some of those really important parts that many of you are probably tired of hearing, but it felt like the right thing to do. So let's just talk about a couple reminders as we're so glad we have this new guidance and that things are moving forward, and we don't want to lose sight of these other important pieces that help make this possible. So again, as I said last time we met, one of the most important things we can do to help protect each other and those we care about living in long-term care facilities is to get vaccinated. And all adults are now eligible for a booster shot as well. So if you were vaccinated earlier this year and your 6 months is past, we encourage you to follow the recommendations. If you're sick, stay home. We should not be going to long-term care facilities if we think we have a cold, or if we're not really sure. It's not worth the risk right now. So if you're sick, please don't try and make a visit to a long-term care facility. And facilities are expected to do a screening. And so if you show any signs or symptoms of COVID-19, they are supposed to not let you come in and do a visit. So be mindful of that. They should work to arrange another type of visit, a virtual visit potentially. But if you are sick, that would be the time when you are not able to make a visit to someone in a long-term care facility. Remember, good hand hygiene is really important. So either washing your hands with soap and water or using a alcohol-based hand rub, wearing a mask. Again, if you read the CMS guidance, it talks about when a mask has to be worn and when it doesn't, but we're all living in the great state of Illinois right now, or we're at least talking about facilities in Illinois. And in Illinois, we have the executive order that requires visitors to wear a mask at long-term care facilities. And as much as possible, we need to make sure we are practicing physical distancing. So if you're there to visit a loved one, it's expected that you stay at least 6 feet or more distance from other groups of people. So this was the guidance we talked about last time we met, and really I still call it our game changer guidance. it was a major shift where the feds have said, we're going to kind of take a step back. We have all of these other kind of safety measures in place that allow us to now come to a point where we're going to get back to really trying to protect a resident's right to visitation. And another reminder, we pointed out this nursing home visitation guidance points, this document. Lee, if you could drop that URL in the chat so people have it, it's easily accessible. This document does a great job at pulling out the highlights of the visitation guidance. So we just wanted to give that as a reminder. So this is the piece that's new. On Friday, December 3rd, as Lee mentioned, IDPH released guidance that mirrors the federal guidance. Now the statement that indoor visitation must be allowed at all times for all residents applies to residents in all licensed long-term care facilities in the state of Illinois. Previously, if you remember, that CMS guidance only applied to nursing homes that were certified, so receiving Medicare and Medicaid funding. But now that public health has adopted this new updated guidance, the visitation applies to all of our licensed long-term care facilities. And just so you have a little bit of background, when the Department of Public Health sends out this guidance, it goes out by a Siren notification. And all facilities should be signed up to receive this information. But if you're talking to a facility administrator or someone who says, I didn't receive this guidance, I don't know anything about it, you can just suggest to them that they Google IDPH long-term care facility guidance. That's the way I get to it if I'm not pulling it from my email inbox. And the information's really easy to find. So if you or your loved ones being told that visitation isn't allowed or the facility is restricting visitation hours, this is the document that I encourage each of you to use to have a discussion with the facility staff and try and work through and better understand where they're coming from and make sure they have access to this document that shows exactly what the parameters are. So I mentioned simply Googling IDPH long-term care facility guidance. And this is where I go. It'll take you to this website, usually one of the first links or first hits you'll get when you do a Google search. And all you have to do is click this button right here that says long-term care facility guidance. And whenever the Illinois Department of Public Health issues revised guidance, they always have it available on this page. So if you click that, it will give you the most recent version of the guidance. And when you click it, it'll show when it was most recently updated.
And Jessica?
Yep.
Just so everybody here today knows, it's also in the chat.
Oh, thanks, Stephen. That's great. So,
Jessica, I'm going to add a suggestion, which is print it out and keep it with you.
yeah,
That way, if you have a problem, you have it in your car.
yep. It's kind of long, but it is what it is, right? So
Yes.
it's worth it if it's going to allow you to have that in order to enable you to have a visit. I want to just focus on two main points that you'll find in this guidance. And again, it's stemming from that CMS guidance. CMS is Centers for Medicare and Medicaid Services, the federal guidance that was issued about 3 weeks ago now, I'm guessing. Facilities must allow indoor visitation at all times for all residents. And if you read the guidance, it's even during an outbreak. The 3 points you see on the screen, I actually copied and pasted straight out of the guidance. So I hope you'll forgive me, but I'm just going to read these to you. So you're hearing the words that public health put into the guidance. While it's safer for visitors not to enter a facility during an outbreak investigation, visitors must still be allowed in the facility. Visitors should be made aware of the potential risk of visiting during an outbreak and adhere to the core principles of infection prevention and control. So if a facility is telling you they're an outbreak, you need to gown up, mask up, glove up, you've got to you've got to follow those rules of infection prevention and control, but you should be allowed to still visit. If you'd like to visit during an outbreak, visitors need to wear a well-fitted mask, whether or not you're vaccinated. And really, visitors are expected to wear a well-fitting mask anytime you visit a long-term care facility, regardless of vaccination status. Ideally, if you're visiting during an outbreak, you're going to visit outdoors or in a residence room, due to the fact that we don't want to be, we want to minimize the opportunity for the germs to spread, really is what that's doing. If a resident has a roommate and one can't leave the room, obviously they've got to work through that. But the bottom line is we should not be hearing anymore, oh, well, we're not allowing visitation because we're an outbreak. This guidance changes that. They shouldn't continue to do that. So if you're being told you can't visit your loved one because there's an outbreak in the facility, I would ask for more information. I would ask if they've read this guidance. I would say, I understand that IDPH has said it's safer for visitors not to come, but that they still have to be allowed. So how can we make this work? If you hit another roadblock after roadblock, reach out to your ombudsman and work with the ombudsman to help advocate for visits. And it may be also that a complaint needs to be made with the Illinois Department of Public Health. So there's some options, but I always encourage you, as I think I said this last time, start with the person most directly involved. Who's saying you can't visit? And what's that reasoning, and try and educate them on what this guidance says. The next slide, we talk about, I pulled from the guidance that facilities must permit residents to leave the facilities as they choose. Again, these aren't my words on the screen. These are the words directly out of the guidance that Illinois Department of Public Health issued on Friday. If a resident wants to leave, the facility should remind the resident and any individual accompanying the resident to follow all recommended infection prevention practices, including wearing that well-fitted mask, physical distancing, and hand hygiene, and to encourage those around them to do the same. So they should be providing this education right before a resident chooses to leave, but they have to let a resident leave. And residents should be screened for signs and symptoms of COVID-19 upon return. So if a resident wants to leave, they have a right to leave. It is expected that the facility does a screening when they return. Those two pieces, if you look at the guidance, they're highlighted in red. So all of the new text is in red in the guidance. Number 3 and 4 hasn't changed since the previous guidance, but I thought it was pertinent and wanted to make sure you all were aware of it, because we're still hearing about facilities that aren't following this. Quarantine is not recommended for residents who leave the facility for less than 24 hours. That's vaccinated or unvaccinated. So if you leave for a few hours to go be with your family or to go to a medical appointment and don't have close contact with someone with COVID-19, it's not expected that you would quarantine. It's not necessary. Public health is saying it's actually not recommended for residents to quarantine in that situation. Residents who leave the facility for more than 24 hours should be managed and described in the new admission and readmission section of the guidance. So if it's under 24 hours, IDPH is saying it's not recommended that someone needs to quarantine in that situation. So those were some of the highlights. Again, I want to refer you back to that, the National Consumer Voice fact sheet that they've prepared that I talked about a little bit earlier. And with that, I'm going to kick it over to Lee. One last thing, I may have to drop off during our meeting today. I'm not sure I'm going to be able to stay on till the end. So if I do that, I apologize in advance, but you're in good hands with Lee and the rest of the crew here.
Thanks a lot, Jessica, for sharing.
Thanks a lot, Jessica.
Sorry. Thanks a lot for sharing that. And that was really, really helpful. I think it's really important, the information she shared at the beginning regarding that, all the basic infection prevention, because there are other things going on right now. I know I myself got the flu last week. So we need to be mindful that it's not just COVID-19 right now that we're all worried about. There's other things that are also happening, and just to keep our vulnerable loved ones, that live in long-term care, very safe. I think that that's really, really important, all those basic infection prevention, and stay away if you're not feeling good. I think that's always, just stay away from anybody. Not just even long-term care, just stay away from anybody. I see that we also had Deb Bursall has also joined us today. And Deb is actually with the infection prevention team, and has been so kind to present for us numerous times regarding every time there's been updates, or just to be a support mechanism for our council here in regards to this whole visitation, because this is really difficult for people. I do know that there have been some questions that kind of been hearing, and please make sure that you put your questions in the chat if you've got questions, or you can unmute yourself. You could also raise your hand, which is on the, I believe it's in the reaction. If you click on the reaction piece at the bottom of your screen, you can click on that and you can raise your hand as well, or unmute yourself and just say, excuse me, Lee, I have a question I'd like to ask. One of the questions that we've been asked is about kids, and kids being able to come in. Jessica, do you have any thoughts on that? Or Deb, do you have thoughts on, are children allowed into long-term care facilities right now during this pandemic?
Hi, it's Deb. I just unmuted.
Great.
And Karen's on too, just so,
Great. I
so
didn't
you
see
guys
that
know.
one.
That's okay. Okay, children visiting in congregate care settings. I'm going to take a real broad view because for 20 years we had, and the facility, the care community that I worked at, 25 as a matter of fact, they just had their 25th anniversary of an on-site childcare with 60 children from 6 weeks to 5 years. And we had a lot of intergenerational programming. I will tell you right now that after, and because I was their nurse, I sort of got in the middle of a lot of pediatric stuff as well as, care of older adults. We stopped intergenerational programming generally, stopped right after Christmas, and we stopped till pretty much April. This is way pre-COVID, because what we found is we were either having RSV or something going on in the childcare, or we would have respiratory outbreaks with our older adults. And so we just found it was easier, rather than coming up with these great big plans and then having to cancel at last minute and having people disappointed, that we sort of, would cancel that. The reason that I'm framing it that way is, as you all know, I mean, I was never sicker than when my kids would go to Sunday school, and about Tuesday, they'd come down with something, and by Thursday, I'd have whatever it was. Children can carry organisms, and especially older or younger children who can't cover their coughs, who can't sneeze, who don't have really, can't cover their sneezes, who really have an issue with containing drainage. That can be a real challenge. So basically what we've been saying to the care communities, you'll notice that in most of this, there are not age restrictions. However, you'll also know that in hospitals, most of the time, there are age restrictions. So we've basically been saying case by case when it comes to care community policy. However, it is important that intergenerational contact between grandparents and great grandparents. So it's a fine line. Once again, it's risk and benefit. And I will, and I'm going to back up a little bit. A lot of what Centers for Medicare and Medicaid Services looked at, what CDC has looked at, and what Illinois Department of Public Health has looked at are the concepts of risk and understanding risk and benefit. And very early on in the pandemic, obviously, because you're dealing with 40% of the deaths in 2% of the population that have occurred in long-term care. There was huge risk, but we didn't have as many tools in our toolkit as we do now. We now have vaccinations. We have monoclonal antibodies. We understand that masks work. We understand that hand hygiene works, and we understand that social distancing works. And this has been borne out in the evidence, in the research, and in the evidence. So we have a lot more tools in our toolkit than we did when this first started. And those are parts of the things that adults who live in congregate care are adults. They should be treated as adults. Evan Schulman, who is the head of CMS Long-Term Care Division, basically said people aren't in prisons. These people are not locked up. They have rights. And as you all know, from 1989, when the Omnibus Reconciliation Act came through, when OBRA came through in 1989, the Nursing Home Reform Acts, residents' rights have been one of the foremost issues, and it's just been pounded into people's heads who worked in long-term care that the residents do have rights. The pandemic sort of throws things into different perspective, but now that we have more things in the toolkit, this is why CMS is basically saying, as long as people understand the risk, both the resident and the family members understand as much as possible, or the POA understand the risk of increased numbers of people interacting at close range, and understand what you can do to reduce that risk, people should have the right to have visitation. So back to children. Yes, people should have the right, but you've got risk not only to the person who is living in congregate care, but to the child itself, especially if you're talking about children under 2 years of age who can't, really under 2 years of age. CDC doesn't necessarily recommend mask use, and they're too young to get vaccinated right now. So you've got more risk coming in there. So we've basically been saying that it's a facility by facility choice. I would say it's a person-centered choice, but that you're really going to need to communicate very clearly and understand the risk of bringing small children in. And I can understand if in the same way hospitals do, where they do age restrictions, if care communities do that. It doesn't mean that everybody gets restricted. In the situations that I've been in before, if you have small children, you can, there's ways that you can socially distance and see. You can have people who come, you have the child and you have a couple of adults that come with, you can have them swap out when they go and visit the family member who is the resident in the facility. But there's lots of creative ways, person-centered ways that you can look at things like this. But yeah, there's no easy answer here, but it's risk. And also risk of people, being over isolated. That's part of what CMS looked at, and that's part of why the guidance has changed.
And this is Karen, I was just going to add to that, Deb. Bottom line though, Lee, and I don't know if this is where you were going with it, but IDPH will not make a recommendation regarding that.
Exactly.
We do not have, meaning IDPH, mind you now, we do not have a stance on that. It is a facility-based policy related to children.
Yes, exactly.
But obviously CMS is wanting visitors in, but the long and short of it is IDPH will not say no children or all children or anything along those lines. Okay.
Mm-hmm.
So can I add to that?
Go ahead, Carrie.
So what I've been trying to tell people is go talk to your facility director. They're, and the same thing of what Deb and Karen are saying, to weigh the risk and the benefit, because there is great benefit for the residents to be able to see their grandchildren and great grandchildren, but if you speak to them ahead of time, use the, sign, the guidance says residents are allowed visitors of their choosing, and then use that to work on a plan of how to do it. If it's, you're going to meet in a room up front, so you're not taking them through the building. There are ways to do it.
Right.
Exactly. And that's what Deb's
them and not, and then if you've run into, they're not budging whatsoever, then call your ombudsman, please.
Mm-hmm.
Because, especially A, with the holidays coming, and B, if we, the ones that bother me the most are when I hear that they wouldn't let the grandchildren in when somebody was end of life.
Right.
Okay, reach out, let somebody else help you at that point too. Don't just let the facility say no if there, there is ways to work this out.
Good point. Good point.
Yes,
Yeah,
excellent.
and I think, too, like what Deb was saying, if you've got a brand new baby, I mean, brand new, should that little one really be coming into the building, especially if you're in an outbreak? Again, those are the risks. We got to weigh it all and look at I think it's case by case basis.
Hey, Karen, I've got a
Yes.
question on that.
Yeah.
Should the facility, the nursing home, be restricting a baby, in your scenario, it's maybe not the safest thing for a newborn baby to be in a facility with an outbreak. Is that the facility's responsibility to be parenting that child?
Oh, no. You mean as far as taking care of it while they're there, or?
No, what I mean is by
oversight.
prohibiting the infant from being in the facility because it's a risk to the infant.
Right. Again, from an IDPH perspective, they're not going to take a stance.
Neutral
We've asked.
on that.
Yeah, they're neutral on it. They have said facility policies. So I think that's when, like Carrie said, you just try to negotiate, so to speak, with the administrator, come to a common ground. And if not, reach out for assistance.
And
That's
as the
probably,
ombudsman,
that's probably not a very clear answer, Stephen, but they're not going, it's not black and white, I guess.
and the ombudsman program will work with you and work with the facility to come up with, as Carrie was suggesting, how can we do this as safe as possible? There are risks involved. So if it is a young child, maybe, and there's concern that, well, what's that kid going to run around and touch? Maybe the child can stay in a stroller, right? A 3-year-old could stay strapped in the stroller during the visit, but still allow the visit. So there's, and when I train new ombudsmen, I talk about just being creative and trying to think outside of the box. And I feel like this is another one of those examples where having those conversations and trying to brainstorm and work with the facility to come up with what's reasonable. How can we make this happen in a way that puts everyone to do it as safely as possible?
So I guess part of this conversation, I really love the way Deb and Karen, you talk about that person-centered piece. And I think then this becomes then the frustration on a family member side is person-centered. It feels good for me. I think it's okay to bring that child in. And we're okay with that. We want to take that calculated risk because of the situation that's going on. Maybe it is a death and dying situation or whatever. And how do I communicate that better to the facility? So like Stephen said, so that they're not parenting us. We get to make that choice, and that we're making that conscious choice to take this risk. And I know it's supposed to be, and all care should be person-centered when we're talking about long-term care, and trying to get that communicated over to a facility who's more concerned about the outcome of a risk that I'm willing to take. That's where it gets hard for the communication process to happen. And I don't think there is an answer for that. I think it is just involving the ombudsman and making sure that you're talking from your heart, that you're trying to explain that the reason why this is a calculated risk that you're willing to take, that you're okay with this. I think that we just have to do a job of communicating and not make it be two people fighting with each other, but try to bring it to a place of empathy and understanding with each other. I think that's what we got to get away from this, that we're going to be fighting against each other on some of these things. So I appreciate that answer. I know there are some questions in the chat box right now. Stephen, did you want to go ahead and field any of those?
So one of the questions, I've been hearing about the beginning of legal action in Illinois against facilities where loved ones died due to isolation protocols and/or neglect. What is happening with regards to this response? I have no idea. I've not heard of any lawsuits about this particular.
Jamie, if you want to go ahead even and unmute yourself and share a little bit more about your insights into this.
Sure. It just came up today in a conversation that I had with someone who was in Illinois. I live in Michigan, and she said that she had heard about the beginnings of some proceedings from law firms against facilities in Illinois regarding the deaths of loved ones in facilities. And I just wondered what kind of response that public health has about that, or if there's any kind of knowledge about where the facilities are in terms of their legal protection, because I know in Michigan, some of the people that I'm affiliated with are saying that our government had some kind of an immunity for facilities during the pandemic. And so there's no responsibility on their end in terms of the protocols that were administered, isolating residents more and more severely, causing death and/or
Jamie, this is
suffering.
Karen. You're kind of breaking up a little bit, at least for me. I don't know if it's for everybody else or not, but my understanding is that Illinois has that same, I'll say, you said immunity or protection, that facilities did have that protection from the pandemic, as far as with lawsuits. Now, Deb may know more specifics than I do, but I thought Illinois was under that as well.
And to be perfectly transparent, I actually have no idea, exactly what the legal ramifications are of anything. When it comes to that, I apologize, but I really don't know.
And I can tell you that from any family member
I'm
I've
just
spoke with in
curious.
Illinois to any attorney that I spoke to, most attorneys won't touch it. And I've talked to some really major attorneys across the state, and most of them here in Illinois are saying they will not touch this.
Yeah, I haven't heard anything of it either, but I think that's a good point that you are bringing up, Jamie. I mean, just that these are things that rumors, or information starts to hear, and that probably is going to be something as we're coming out of the pandemic, we're going to hear more and more about. So it would be curious to see how this evolves. But we don't have any insight into this.
Yeah, Jamie, I echo what, this is Kelly, the State Long-Term Care Ombudsman. I echo what Lee has said. At my level, I haven't heard anything either. And we may start hearing, but I can't speak to that question either.
I did a quick Google search and I found one from January. I think if there's going to be lawsuits, at least right now, they might be real specific to individuals, but I don't want to say too much, because if there is some big lawsuit out there, I don't want to implicate myself in some way.
Are there any other questions in there, Stephen? Go ahead.
Let's see, Jamie had asked what was the COVID mortality rate for children under 2 years of age, and then she answered it. 0.3 of all COVID-19 deaths were in children 0 to 4.
Right, and Jamie, that's a really good point, but I was thinking about it the other way around. If you have a child who, because a lot of the illness, you're exactly right, a lot of the illness in younger children is mild, but that doesn't mean that they can't bring it into the care community. And especially if they have, asymptomatic, or they have low and they can't wear a mask and they can't perform hand hygiene. So you have to look at risk of running both ways. I mean, believe me, I'm a huge one for intergenerational. We advocated for it like crazy, and we had tons of intergenerational interactions, and it was very person-centered, and we did it case by case. But that it goes both ways, and you could have children bring things into the person who is in the care community as well. And I'm not just talking COVID.
And I think what you said, Deb, is that it really needs to be case by case. Because like
Yes.
my 6-year-old or my 7-year-old, 7 now, he's been 7 for 11 months now, and I forget it all the time, but he hates wearing masks. He'll drop it down, wears a chin strap all the time. My 4-year-old, on the other hand, she'll yell at you if you're not wearing a mask. Like, she'll walk up to you in the store and say, "Get your mask on." And she washes her hands like nobody's business. So it really does need to be case by case, because if that kid can follow the rules and the resident wants a visit from that child, then it should be allowed.
Right. And the other thing, let me add, is offer to let them be tested. Okay, that will in itself alleviate some of the concerns. If you're willing to let your child be tested, it's beneficial to everybody. As much as we don't want to worry that the kids are asymptomatic, it is possible easily. I work in a school with 300 kids, so it's not a very large school. As of today, we have 7 positive this week, and we have tons of kids that are just got their first vaccine that are waiting for their second. But, we're testing kids left and right to keep them safe. So if nothing else, offer to let them be tested before they go in.
Yeah.
So we had another question come up. Something I've heard a lot is that facilities continually say visitation can't take place in the rooms. The guidance kind of leans this way as well. However, many facilities don't have private common areas, and residents and families would like to have private visits finally. If the facility doesn't have private areas outside of the residents' rooms, is it okay to have visits in room, even if the resident has a roommate?
This is Deb. I can start and then Karen can go. There's actually some pretty clear guidance on in-room visitation. And if the facility's in outbreak, it actually says, Karen, correct me if I'm wrong, but it says that in-room visitation is preferred. So I'm
Yeah, that's why I was
uh,
going to agree. I'm Amanda, you think it leans the other way. So is there a sentence or something maybe you could refer to? We could look at that and the next iteration consider, changing some of the language or something in there if you think it reads that way, because our understanding was that we do want them to occur in the room.
I do think, though, that is a piece is where it's that roommate situation. If the roommate can't leave the room and the resident can't leave the room, then what do we do?
So Karen, you're correct. It is written the way that what you're meaning it to say, and facilities are still trying to not allow that. They're trying to come up with reasons why it shouldn't be done in the room. And it's not all facilities, it's a few here and there. And maybe, even on Friday,
clarify that again or something. Okay.
Yeah, clarify again exactly, yes, this is exactly what we mean. And
there is some language in there, though, about if the roommate is immunocompromised, unvaccinated,
right.
Then we do again expect that kind of a discussion with the facility to say, is there another room that we could make this happen? Because we do still want a private visit. We understand that there are not necessarily all these large common spaces for these visits to occur, but is there another empty room? We know there are lots of facilities that have a lot of licensed beds and their census is really low. So could one of those extra rooms be used as a private visitation? I mean, there's opportunity there if we have those discussions.
And like my son's facility, most of the time they'll take the route that they would prefer to move the roommate to more of a common area where staff and residents are anyway. So I'm in his room with him to keeping me, so I'm more contained. So even if you ask, okay, is it possible for you to move the roommate so I can be with my loved one?
And the original language in one of the first guidance, it did say that, asking having the roommate leave the room so that, you know, and then of course, then your son then could leave if the roommate got a visitor, you know, that kind of thing, kind of take turns, so to speak, if that's doable. I mean, again, we always have to take care of, we have to consider rather whether that roommate is somebody that can be moved. You know, I don't, it would depend on the status of the roommate, I guess, too.
Yeah, and Amanda, I'm looking at your note, your further note. It says the portion immunocompromised. I feel as though majority of residents would be labeled as immunocompromised. There's a difference between a tired, older immune system and someone who's truly immunocompromised. That would be somebody who's getting chemotherapy or somebody who's on chronic steroid therapy. That actually has sort of a medical implication. It's not just that you're older and your immune system's tired. So
We can clarify
we can
that.
clarify
Yep,
that. We
sure
can
can on
definitely
Friday.
clarify that.
Great.
Thank you for
Deb,
bringing
Deb,
that up.
Deb, I like how you said that too. There's a difference between the tired, you know, rundown system versus truly immunocompromised. That's a great way to say it too, for ease of understanding.
And I think that just for people to understand that may not be aware, on Friday, there is a provider call that Deb and Karen play a pivotal role in. And there's answers and questions that also happen in that. But they take information that they hear through the course of the week, and they do add it into those calls. So that's important, that from what they hear from all of you, because that does help them be able to help guide the facilities in a better manner for what it is that we're actually hearing and the interpretations of some of the things that that may be written. So
we
thank
say
you
that
very
it's a meeting with our 700 to 1,500 of our closest friends
there you go.
every Friday.
Exactly.
And many of
we're
us
all
look
there.
forward to meeting with you and the rest of your closest friends on Fridays.
We
And
become
for
good
the
buddies.
families, so you know, Deb and Karen speak up for us. They
They
are
do.
the reason we have the visitation. They are the reason facilities eventually get it drilled in their head, because Deb and Karen keep saying it over and over again. So, you know, we're very lucky.
And the information that we get from these meetings, we also do share with them when we're hearing ongoing themes. And because that is what can help make some of that change happen. And I do think it's important too. Sometimes it feels like we can be naysayers in regards to the facilities. I think it's important. Pat actually wrote that her husband's facility allows room visitation. And if there's a roommate, the curtain has to be drawn. They're strict about not interfacing with other residents, especially those who have dementia, who keep removing their masks and hanging out near other residents' rooms. So that's one way that this facility has gone about doing it, which can be a food for thought for other people, even to share that with their facility that they might live at or their loved one lives at. Stephen, is there another question you want to throw out?
Yeah. What is the guidance for residents to wear masks? I know staff are expected to wear them, although I have witnessed staff who are not or are blatantly not wearing them appropriately. But oftentimes I see residents not wearing masks.
Well, that's one thing that the research has really come around to show, that surprisingly, masks work not only as personal protective equipment when you're putting them on people, but they also work as source control. And so as much as possible, CDC, that's part of the reason why the evidence shows that it helps for people to have masks on. So as much as possible, you want to have not only the staff wearing masks, and if you get into a situation where you see people who are not wearing masks, your ombudsman might be a good person to talk to, because that needs to get reported back if people aren't wearing masks, because we're all in this together. I can tell you, when I'm in facilities, I always have an N95 on. But as well as eye protection. But for the residents, the guidance is when they're out of their rooms, or especially when they're out of their rooms, unless they're actively eating or drinking, as much as possible, they should be wearing masks. Now, I understand that there are definitely persons who can't keep masks on for one reason or another. It could be because of, they need memory support. It could be because they have a health issue. But as much as possible, the guidance is when they are out of their rooms, and even sometimes when they're receiving direct care, it's a good idea for a person to have a mask that covers their nose and mouth, well-fitting mask that covers their nose and mouth.
And
Stephen.
so another question was asked to provide information for those Friday meetings, and Lee just posted a link to sign up for Siren, which will give you the information to sign up for those Friday meetings.
Hey, Karen and Deb, will you go over for people what you tell facilities as far as residents having meals with their loved ones or a cup of coffee or any of that? Since that is brought up as an issue somewhat
yeah.
regularly.
Well, we thought we kind of hit that pretty hard prior to Thanksgiving, but sure, we can bring it up again. I mean, I know there was I know that Deb created a slide the last time and added to the deck about bringing in cookie and having a cup of coffee, et cetera, but sure, we can bring that up again.
Yeah, definitely.
Yeah. Hey, can I take 1 second, Lee, and just clarify something, even though I did put it in the chat? I just wanted to clarify Carrie's original statement when she said facilities cannot require an N95 unless they provided a fit test. The facility will not fit test family. They'll only fit test their employees because it's an OSHA requirement. So the general public can go to Menards or Lowe's or Home Depot, whatever, and purchase their own N95s if they feel more secure with that type of source control and wear them into the facility. But a facility should not, one, require them to wear an N95, nor should they provide them one. And the reason would be they would be held liable for something like that, going back to Jamie's statement, because they have not fit tested that visitor to know if they are medically able to wear that without any difficulty. You know, perhaps they could have a heart attack or difficulty breathing, et cetera, because we all know that they are difficult to breathe out of. So they should not be offering those and providing those to general visitors because they do not fit test them and should not fit test them. But the public can wear them, but if they're on their own, so to speak.
Thank you. Thank you for clarifying that. Another question that we've gotten is when people are taking their loved one out of the facility, they're asking where they are going. And it feels like that's an invasion of privacy because they're not asking the staff members where they're going when they're not working. Can you talk to that? Are they allowed to ask us where we're going? Do we have to tell people where we're taking our loved ones?
That's a really interesting question because I didn't even think about that. People
I
used to
didn't either.
volunteer it all the time. Generally, you know, on the list, it's just if they like going out to a doctor's appointment versus going out to a restaurant. I just wasn't even thinking about that. We're going to have to talk about that because I mean, that's a really good point, Lee.
I think that, you know, when you screen, you're asking about were you exposed to somebody? Are you aware of being exposed to somebody with COVID? So it really wouldn't matter if you were in a home, a restaurant, or
Right.
wherever.
Yeah.
So I would say they could get away. They wouldn't need to ask you where you're going, but I don't know that there's ill intent with it. You know what I mean? I think it's probably just.
So there are some facilities that are asking the question, trying to use that as a restrictive measure.
Okay.
It is definitely going on.
So like, give me an example, Carrie, like what are they saying that
So,
it must feel that way,
they're like,
obviously,
"Oh,
so.
we don't want you to take them to Walmart, or we don't want you to take
Oh.
them to the store because they're going to be exposed to too many people. Yes, it's okay for you to take them home, but we don't want them out in public. They're nowhere, you know, they are trying to use some facilities, and I will clarify that as some are using it as a restrictive measure.
You know, we do say something about avoiding crowds and things like that. So I don't have it exactly in front of me, the verbiage. So let us look
Right.
look at that and talk about that again and kind of follow up with you guys, because that might be on us. I mean, we do say that to avoid crowds and gatherings, because you do not know what, you know, what you're running into.
Correct.
So I think
Realize we
that
have
would-
our infection prevention hats on when we're doing
yeah,
that.
So
Right.
I don't think there was any ill intent there, but we'll talk about it and see what.
No, I agree. And that's why I'm saying it. I mean, and this is why it's best bringing it up with you guys, because you'll talk it over, you'll look it through. Because obviously, I mean, I just sent Deb and Karen a picture of my son at a concert 2 weeks ago. And it was his first outing, real outing since COVID started. And he was one happy little camper. But, you know, there are other facilities that don't want their residents even going to Walmart. And they might want to go Christmas shopping. They might not want to let their daughter do all their shopping for their grandkids. So, you know, it's another one of those things we all have to work together.
Yes.
And Kara
We'll
has
talk
a
about it.
question. She had her
Understood.
hand up.
Yeah, and this was brought about to us from a family member. And as Jamie said, privacy is privacy. It felt like they were being grilled about it. And so that didn't feel comfortable to people. So it's just something, you know, it was like they want to approve or not approve. It was in that vein, as opposed to that avoiding crowd issue. So yes, Kara, if you want to go ahead, and you had something about the sirens you wanted to.
Hi, this is Kira. So ironically, I had already looked up the Siren notification registration earlier today. Just to explain, I work at a Center for Independent Living, and I also work closely with Illinois' Emergency Management Agency. We're creating an Access and Functional Needs Advisory Committee, where folks with disabilities will be at the table to ensure that our disaster response and management services are inclusive and prioritize us. So just to say, when I look at this notification registration, it seems like it's only for folks who are presently affiliated with state agencies. So that's one thing I wanted to point out. And then when I was registering for it, it seems like, because I happen to be working for a Center for Independent Living who's funded by, you know, partially funded by the Department of Human Services, I just went under shared partners, but I can't write an organization. That's so
we'll have to do some investigation. I'm not sure that that's open to the general public.
okay.
Yeah.
Okay, so that is good to know. But you know, something that we will be looking into through our Access and Functional Needs Advisory Committee, because I was excited to find out that there's a Siren notification, is how can we get these notifications out to our actual public? Because emergency management, you know, preparedness, response to recovery affects us all. So yeah, if that could be looked into, that would be really great. Thanks.
Yeah. Thank you for that, Kara. Because and I want to just put a plug in for our next meeting next time. We are doing it on how are we titling it? Let me see. The gift of empowerment. And what we're going to be doing is sharing resources. And so one of those things is if we can find that if there's a mechanism, I can do some research on that, on how the public is educated better on some of the things that IDPH is doing. I can explore that. Deb or Karen, if you've got any ideas on that for me, please share that with me. Because what we'll be doing is we'll be talking briefly about the various empowerment tools that we're going to be sharing, or information that we're going to be sharing. And we also do have a group on the Jane Addams Senior Caucus is also going to be sharing with us some of the things that they are doing as a means to try to inspire other people on some tactics that we can come together to do to help continue to advocate for ourselves and not feel that we have to be dependent on others for our advocation. So that will be our next meeting. And so it will be 2 weeks from now. And I will be creating a resource list on this. So if anybody, that's what this group is about. If anybody has any resources that they would like to share with anyone, please feel free to email me. I'll go ahead and pop my email again into the chat box. please feel free, or if you're looking for resources for anything in particular, please tell me about that. I can put my thinking cap on. I can reach out to a lot of people that I know and see if we can come up with those for you, because the purpose of these meetings is for empowerment, and with that information. So we really do want to make sure that that happens. I think we might have one more time for a question. Bruce, I see he just asked a question. Is it a privacy issue for a facility to ask where residents are going when they leave the facility? So that's another issue, is not just a family member, but what about the resident going out of the building? Does that become a privacy issue for the resident as well?
Bruce, that's a great point. And we're going to have to take that back and talk about it, because we've been looking at something within the framework of a pandemic and trying to prevent introduction and reintroduction of the virus into the building. And yeah, it's important for us to think about, privacy concerns about where people,
Yeah, we'll have to talk to legal probably, because I'm not sure.
Yeah, I think that is a great question, because I do know that is something, again, it does feel as somebody, this is your home. And whenever you leave your home, you've got to tell the person, where you're going. We're adults. So that's a very interesting question, Bruce. Thank you for bringing that up.
Hey, Bruce. Right after work, I'm going to go over to the Nunya Dam for some personal business. I mean, you can just throw that out. Nobody says you have to answer it honestly. If you don't want to tell them, don't.
Boy, I think I've been giving Bruce that advice for months.
They won't let you leave the facility. They won't let you. What the heck is wrong with my mic? Can you hear me?
Yeah, we
can hear you now.
My mic's on.
Yes, we can hear you.
They won't let people leave the facility unless they know where they're going, especially me. They're really strict with me. They have to know where I'm going, the address and everything, and what time I'll be back and all that. I mean, that's why I'm curious. Is it a privacy issue? Well, that's why I'm curious about it, because I mean, I guess if their family's taking them out and they say, well, hey, we're going, if they don't tell them where they're going, then residents going, is that a privacy issue for the resident too?
That's a good question.
I don't.
Yes. And I think, and they're going to look into that for us, Bruce. So we'll make sure we get back to you with that information. That will be part of our next meeting.
If I tell my facility I'm going across the street to have a drink or something like that, they won't let me go out. Okay. Which, I don't. But I mean, if I was telling them, hey, I'm going to the bar or something like that, they're not going to let me go. And that's just the way it is. That's how they are here. And same with the resident. If the resident wants to go out with the family and have a drink, they're not going to let them go. And
that doesn't feel person-centered. That does not feel person-centered. People are adults and they can do what it is. So Bruce, I know there's a lot of advocacy issues around where you're living right now. And that's something, again, to bring up to the ombudsman, because that's something that, and I'm not sure if you've done that. There is one last question I just did want to make sure that we asked, and that's in regards to visiting hours. Can they institute visiting hours, such as 9 to 5? That's what we're hearing that some buildings are doing, which makes it extremely difficult for a person who's working during the daytime.
I'm trying to get that clarified with other licensed facilities, but skilled nursing basically is very clear that it's essentially 24/7 and it's the resident's preference. That's very clear within CMS. What I found, because I just went through and looked at all the different licensures, is some of the licensures do have visiting hours, which I thought was very interesting. So I can't answer that for the Illinois licensed facilities that aren't licensed by CMS, but I did ask that and trying to get clarification on that.
So
If Dennis, you get some clarification, will you let me know? I didn't realize anybody could add that.
Carrie, I didn't either until I started pulling 295, 340, 350, all of the 77 codes.
And they've been in there. They weren't added.
Yeah,
No,
since
that's
2005. And I was like, really? Because, I come from the mindset that it's 24/7 visitation normally in normal world times, in the normal time, that we had to let people in, people came and visited at all times, all times. And it's
Right.
very clear, because I pulled the state operations manual and started looking at that from 2017, just to make sure I was on solid footing with CMS certified facilities. But the licensed facilities are slightly different. So I will keep you up to date.
Yeah, I'd appreciate that, because obviously that is the one question and concern I hear.
And if you look at it, go into the 77 code and
Okay,
look at the different facilities, and look under, they're in slightly different, so you're slightly different areas, but look at them. It's under visitation. I think communication and visitation in most of the licensed.
okay, but if they fall under CMS, they must follow the 24/7.
It's 24/7.
Okay, that's what I tell people all the time. Okay.
Well, with that, I just want to ask everybody if you could please make sure that you type your zip code in the chat box, and then I'm going to go ahead and I'm going to launch the poll. If you could just please answer the single question, just how beneficial today's meeting was for you. We appreciate that. We do track this information so we can see how well these topics go over and what topics work best for people. So again, if you have any ideas for topics, please do not hesitate to type those in the chat box. And I'm going to go ahead and I'll be staying on. I'd like to be the last one standing. So please go ahead. And if you have any further questions that you want to ask, you can go ahead and do that. Or if you want to bring up anything about anything else, that will be great. I'm going to go ahead. I'm going to end the poll now. And then I'm also going to end the recording. And I just, again, want to thank everybody for being here today. Particularly, I want to make sure that I thank Deb and Karen for helping us answer these questions today, and Jessica for providing that information in the beginning. It was all really, really beneficial for everybody. So thank you so much.